Okay, everybody, we're going to go ahead and get started. Thanks, everybody, for being on this evening. I put a call out last webinar for topics, and this one came up as one that people wanted to talk about, calming supplements and also different management strategies for horses that are displaying behavior challenges, I guess. And I've got a little video that I'll show you a little bit later on because I think most of you have heard me talk about let's try and get to the root cause of what's going on. So before we start telling our clients that they need to be feeding a calming supplement, we really want to get to the root cause of what might be going on. Is there is the person overfeeding the horse? So are they feeding the correct feeds to the horse? We don't want to have a maintenance horse that's doing, some light trail riding, eating a really high sugar and starch sweet feed, or even just, a whole bucket of oats. So we need to make sure that we're not overfeeding, number one, and we're not feeding feeds ingredients that are too high in energy and energy types that we know will elicit bad behaviors, like those high sugar and starch diets. Is the horse doing enough exercise in relation to that food intake, which really feeds into those first two? If you're overfeeding your horse, that extra energy is either going to get laid down as fat or they've got to release it somehow. So just really evaluating, asking a lot of questions, and really evaluating the exercise level, and not just how much riding a person does with their horse or long lining, but think about, do they live in a stall most of the time? Do they have a small run that they go in, a small paddock, or do they get to go out in a large field? And then in that large field, if we want to force exercise, we'll put the water in one corner, we'll put the hay in another corner, and I'll put the feed bucket in another corner, and that will force exercise. So how much actual exercise is the horse getting per day? Now we get down to the things that might actually cause some discomfort to the horse. Is there enough fiber in his diet? So evaluate, are they feeding enough hay? Or look at the types of ingredients they're putting into their diet, because I know, we've got a lot of folks on from California, and there are some folks that don't feed a long stem hay, but they feed, their forage comes from a cubed or pelleted source. So are they feeding enough? Because it doesn't matter what form your fiber is going to come in, you still need to feed that at least 1.5 to 2% of the horse's body weight. So are they getting 15 to 20 pounds per day of their fiber source? As I mentioned, are they spending too much time in the stall or stable? Do they get out? We find a lot of horses this time of year, at least out here on the East Coast, we've had a winter storm go up the coast and dump some snow, and our horses maybe aren't getting as much turnout as they normally would, or riding as they normally would. Is it necessary to reach immediately for a calming supplement, or do we just try and do a little more exercise with them? We need to ask all these questions. Does your horse have enough time to relax if they do get turnout? Do they interact with other horses? Stress, we know ourselves, anxiety, stress causes stiff muscles. When we're stiff, we're really uncomfortable. And you got to, a horse's, all animals have either a fight or a flight response, and horses have that flight response. And so their immediate response to pain or a stressful situation is to try and get away from it. And so that's why I'm going through all of these questions, to really get down to the nuts and bolts of what's actually going on with the horse. Are we decreasing their stress levels by having them interact with other horses, by taking away other horses by putting them in stalls that don't have a outward facing window. There's a whole lot of things we can do to increase their stress levels, and then that in turn will potentially change their behavior in a negative way. Is the barn or stable environment stressful? Is there a lot of noise? Are they right next to the feed room? Is it dusty? You wouldn't believe the amount of barns that I go into where they're literally blowing the barn aisle out with the horses in the stalls. That is one of the worst things you can do. Number one, it's super stressful because it's noisy. There's stuff flying around. But number two, you've seen the amount of dust that you're blowing up and that horse is inhaling. So don't do that. I don't even like for people to do aggressive sweeping when the horses are in the stalls. This is all getting back to, is there a pain association? Is there pain, an underlying pain response to the saddle and bridle fit correctly? Are his teeth in need of attention? Is this a new behavior? When did it start? Why did it start? Maybe it started when you changed the hay because his gut now hurts, or maybe it started when you took his pasture buddy away. Is there an outside trigger for this behavior? Is my horse losing weight, i.e., are we looking at some other symptoms that have gone along with this change in behavior that might lead us to believe that was gastric ulcers? If you have a mare who seems to be pretty moody during certain parts of her hormonal cycle, are you tracking that? Is this uncharacteristic for her, or is this normal parts of her? Hormones will change the behavior, but also there's pain across her loin, and that can also cause a change in behavior. Does it only occur at certain times? Is it only in the morning? Is it associated with feed stress? Is it when you take when other horses leave, when you're riding and maybe split off from other horses? These are all factors to consider. I mentioned that the animals have this fight or flight response, and horses have the flight response, unlike a lion who is going to have a fight response. But you can look at this and you can see, okay, when we have normal or really relaxed state, we've been able to decrease heart rate, and we've got relaxed muscles, we've got increased blood, brain oxygen flowing, low stress. This is a learning people. This is really explaining the stress response and pain response in people, but they're more open to learning. I mean, if you're just trying to block out pain and stress, then there's no way you're going to learn, and your horse is the same way. When we're in that kind of fight or flight because we've been stressed or pain, then increased heart rate. To do this kind of runaway or the fight or even flight, it's going to take energy, and that increases your requirement for blood glucose. The blood is going to go to the periphery. It's going to go to the muscles. It's going to get taken away from the gastrointestinal tract. Rapid breathing. You might notice some aggression, certainly poor focus, and not able to maintain that focus. Now, I want to show you a little video. Let's see if I can bring it over here. I find there is a Dr. Sue Dyson, is one of the world's leading experts on equine behaviors and has really been digging into pain responses in horses. And this is a neat little video. And from this video, she's got a whole slew of videos you can watch if you want to learn a bit more about it. But I'm going to play it, and hopefully you all can hear it. So just let me know if you can hear it.
Blaming the horse for problems is a very, very common scenario. I see it most days of the week. Pain is the last thing that people tend to think about as being the underlying cause of why their horse does not want to do some particular thing. And unfortunately, it's not just the owners that are like this, it's their people guiding them, like the trainer, the coach, their friend. Everybody thinks it must be to do with the horse's either behaviour or a training issue.
my name is Caroline, founder of Equitopia. As part of our mission to provide the horse industry with reliable resources that promote the compassionate training, welfare and care of horses, we reached out to world-renowned veterinarian Dr. Sue Dyson, internationally acclaimed veterinary behaviourist Dr. Janine Berger, and other professionals in the industry who share their expertise in recognising the early signs of subtle lameness.
Which one of these horses has a subtle form of lameness? Horse 1, Horse 2, or Horse 3? And the answer is all 3.
I believe that a very high proportion of horses have some form of lameness. We did a survey of 506 sports horses which were in normal work and the owners had not recognised any underlying problem, and 47% of those had either lameness or other gait abnormalities such as a stiff stilted canter that I know through my daily work are likely to be underlying pain-related problems. Now that doesn't mean that they couldn't cope with those problems. Some of them were low grade, but some of them were also pretty obvious. So to say that they were all low-grade problems is not necessarily true.
I see everywhere, all levels, from novice, amateur competitions, right through to 4-star events like Berlin, Badminton. I see horses that are sometimes really struggling. And it is amazing that owners and riders, no matter what level, are very often unaware.
Many owners and riders rely on their trainers to point out when their horse is not quite right.
Trainers tend to always say, use more leg, be stronger in your back, stronger bit.
Work him through it. You know, the horse is playing up, work him through it. The horse is a little bit lame, work him through it.
Get longer spurs.
Work him through it, and it's always it. What is it? Is it pain? If it's pain, and we're just working him until he either gets better or he's hurting more, then surely it's us who need to be better educated to see it before we have to make it worse.
Why is it that even lifelong horse professionals have trouble recognizing gait abnormalities? We asked that question to Dr. Karen Liebrandt, who says that according to studies done in the field of ethology, there is a difference between the way a predator and a prey animal behave when they're in pain.
And a horse doesn't want to show pain because normally in nature he is hunted by lions or whatever, and he doesn't want to show the lion that he is in pain. And we have to pay really good attention to find it.
And there is absolutely no doubt that if the horse is uncomfortable or worse still in serious pain, that they will adjust their gait, they will adjust their way of going because they are uncomfortable in an effort to try and relieve this discomfort.
Horses are very good in compensating. So if a horse has pain on his left front leg, he will change his way to his right front leg, and he will change a few things in his back all to compensate, and he will get a little bit of pain in his back and a little bit of pain in his hind legs.
Okay, she's lame.
We have various scenarios of the onset of lameness.
So what I found quite fascinating in that video was the discussing of horses being, we all know that a lot of horses are very stoic and they're may not show pain as much as we want them to. They might be under quite a high amount of pain, and that's why sometimes I think it's very easy to notice if a horse is just grossly lame. But if they're just acting out a little bit, then it oftentimes gets mistaken for a behavioral characteristic and not a true pain associated lameness or issue. Quite fascinating how they were talking about these horses being prey animals and not wanting to show pain as a survival mechanism. So I thought that was very interesting in that video, and obviously you can watch more, but just to highlight it that horses often it's not just a small issue, it's a big issue in the whole industry, how we really need to get better at listening to our horses, at investigating changes in behavior, and really digging deeper and seeing if it's more of a pain issue. So we get past that, and potentially then we're going to, we've determined that it's not a gut pain. And if it was a gut pain, then we're going to use something like the Cool Gut. It's not a musculoskeletal pain where we may use some other herbal remedies, or it's not an osteoarthritis where we're going to use something like the Optimum Flex Plus, or if it's a younger horse, we're using the hyaluronic acid or the yucca even, just as pain mitigators. But if we truly then get into the world of calming supplements for the very few horses that actually need them, and I don't want you to take this like I'm trying to undersell the Calm B, which is our calming supplement. But ultimately, if you want to stay in business, you have to be the person that provides the correct solution, not the solution that, well, you can make a quick buck on now, but it's the correct solution, right? The solution that's going to fix the real problem. And if we don't dig deeper into what the real problem is, then we're not going to be able to fix that. And it really is with all of our supplements. We want to make sure that we're recommending the correct supplement for the correct problem. And that's why I do encourage you all to contact me if you've got any questions. So why is magnesium get a lot of chatter when it comes to these calming supplements? And you'll read on any number of different websites that if a horse is deficient in magnesium, it will do X, Y, and Z, and that kind of stems from, every myth stems from a truth. And if we look at what magnesium does, 60% of magnesium is in the skeleton, 30% of magnesium is in the muscle, and it's responsible for some enzyme regulation, but mainly muscle contraction, helps regulate calcium, absorbed in the small and large intestine, and magnesium sulfate actually in large doses that has been directly injected venously has actually been used as an anesthetic. We know that deficiency in magnesium will cause nervousness in a horse and muscle tremors and incoordination, but to be honest, it's pretty rare that a horse is ever deficient. Studies have shown that if we feed extra magnesium, not to the point of being excess, but extra magnesium, we can also decrease nervousness. Maximal tolerable level, because with anything, more is not better. Less is more. Excess magnesium can really compromise intestinal health, so if we're throwing 1, 2, 3 different calming supplements that are all high in magnesium into a horse that didn't actually have a behavioral problem to start with. Its behavioral problem was gut pain because its hindgut had leaky gut and he was showing these erratic behaviors. Now you've just added all this extra magnesium and made the problem worse because we didn't dig deeper into the original problem. So Epsom salts is an Alzheimer's way of adding magnesium to the diet. It was very poorly absorbed and actually had a laxative effect. And if you put too much magnesium into the diet, it can block the uptake of calcium. If there's too much phosphorus in the diet, it can also block magnesium uptake. Magnesium often used in calming supplements, but if we just chronically have our horses on magnesium supplements, excess magnesium supplements, you can really kind of make them immune to it, just like deworming horses constantly without a regular protocol or doing fecal egg counts. You can really make them immune to the uptake of magnesium. Magnesium is really important, so then it's not going to be absorbed for all the biochemical pathways that it is needed for. So there was a study done several years ago, probably about 5 or 6 years ago, actually in Australia, looking at magnesium aspartate, and they fed it at 2 different rates, at 2.5 grams or at 10 grams, and their control for calming was acepromazine, because that is we know that it has a chemical function in the body, and it is a standard control that you can use acepromazine to calm the horse. And what they found is at the 10 grams of magnesium aspartate, certainly the horses mimicked getting this small dose of acepromazine, so it did calm them, but urinary calcium excretion was higher when they were fed that 10 grams of magnesium. So it's kind of catch-22. Sure, it calmed them, but now we start to have higher calcium excretion, not because the horse has a lot of calcium in its diet, but the magnesium, excess magnesium, is blocking the uptake of calcium, and it's being excreted, and that's going to cause its own set of problems, especially if you're feeding a lot of magnesium to young growing horses. The 2015 USEF and FEI drugs and medication guides actually banned IV fluids that contain magnesium simply because of its calming effect. So we have the formula CalmB, and over the years we have altered this formula to make, in years past, it has gotten stuck in the tube and it's never come out very well. And we've really worked on that. And I think now it certainly does come out of the tube better. This is the powdered formulation. It comes in a powder and a paste formulation. The powder has amino acids, a lysine, thiamine. It's got the magnesium. It's got tryptophan, which is known to have calming properties, and then the B vitamin pyridoxine, which is actually B6, carried on some distillers grains, quite palatable. And the paste, as I mentioned, the way we've gotten around what Dr. Duran and I have done with a lot of the pastes is, instead of making them multi-use syringes, so you get 3 or 4 doses in one syringe, we've made them single-serve syringes, and that helps. As soon as you take that cap off and expose it to the air, then we start to have oxidation. It's going to dry and may not be able to come out of the tube well. And how many times maybe you use the tube, use 2 servings, and then 6 months later you use the second 2 servings. So we really wanted to get away from that, and we have with really all of our paste products. Got a very large quantity of magnesium right on that borderline. It's also got tryptophan, the B vitamins. Nothing in the CalmB paste is a banned substance. If you look on any of the kind of FEI, USEF, or even the Endurance Association's guidelines for using supplements, they will all say that there's nothing in a product like this you can test for, but the idea of feeding a calming supplement to alter a horse's behavior so that you may have an enhanced performance effect, then that goes against the rules. So they don't want you to do that, but again, there's nothing in this product that would test. Taurine is an amino acid that supports brain, liver, heart health, potent antioxidant. It supports a really healthy response to normal stress. And so a lot of times these horses might be getting stressed, and this can help with that calming, promoting, supporting that brain and nervous system to promote a more balanced response. Unlike the acepromazine that's just going to sedate them, this is just going to, just give them a bit of a timeout. As I've mentioned in the past, though, before I am recommending either the powder or the paste, we're going to definitely be looking into the root cause. Is it pain? Is it do we need to be recommending another supplement before we recommend this one? The mare relief, I mentioned a little bit ago that if it's a mare that is having hormonal issues during her reproductive cycle, some mares are stoic. They don't show any pain. They don't change their behavior. They're fine. Others, it's really quite painful. And so the mare relief in some horses has been beneficial to kind of mediate some of that hormonal fluctuation. Combine that with the yucca to help with some of the kind of inflammation that occurs at the same time. That can be beneficial for those mares. This has got a variety of different herbal substances, the dong quai, raspberry leaf, chasteberry extract. A lot of this research has been conducted in humans, not a lot in horses. I'm not going to guarantee that this product works for every horse. It's one that I say, well, give it a try. And that's the same with calming supplements, really. If we've determined that the horse may need more of a calming supplement than a pain mediation supplement, then we need to make sure that we're adding that to the diet or giving it to the horse prior to that stressful event or prior to the thing that's going to kind of alter their behavior and make them more nervous. Maybe it's trailering or something. Because once they've had that stress response and they've got those kind of anxious hormones floating around in their body, that adrenaline, then none of your calming supplements are going to be able to combat that. So it's something that you get to know your horse and you know the things that are going to stress him, that you want to just kind of modulate some of that stress. You absolutely need to make sure that you're feeding these products prior to that. Now, I mentioned earlier, is it dietary? And we do know that feeding high sugars and starches has been shown in several research studies, not only just to offer extra calories that maybe the horse doesn't need, but also those types of carbohydrates can actually change the horse's behavior and demeanor. So in a horse that may be a little more behaviorally sugar sensitive, not necessarily sugar sensitive from a metabolic standpoint, they're not got crusty neck or tying up or anything like that, but maybe it's more just a behavioral issue. They don't do well with sugars and starches, just like some children. Then you're going to be looking for a higher fat, higher fiber type diet. Adding the DDA so that they can be digesting as much as they can from the fiber you're feeding them, but also increasing the fat content of the diet, because that's going to give them more of that slow release calm energy. So adding oil to the diet. There are several supplements that are actually banned. This is one of them. Sorry. It's called gabapentin or GABA. They're different brand names, but this is the active ingredient. And in 2012, this joined the banned substance list, thought to have calming properties, but the side effects of the injection, severe fear shaking, near collapse. I mean, I think you can Google all of the side effects of this anyway. So be cautious of these these types of products. Valerian, that's another herbal supplement, reasonable amount of scientific evidence to suggest a calming effect. However, there's no studies that are published in horses, and again, this is also on the FEI prohibited substances list. What about just plain old different management? Can you add a companion? I've seen anything from a companion horse, because they're herd animals, to they have a pony. I worked for a lady who her show jumper had a goat as a pet. And, there's been research that has actually looked at the effect of a calm influence, a calm companion on a kind of naive stressful horse. So you take a horse that's never been in a certain situation, so it's naive to that situation. You know it's going to stress, but if you put it in there by itself, how's it going to respond versus if you put it in there paired with a calm companion? And absolutely, the evidence was significant that it appears to reduce the fear reaction in young, naive, and horses. And part of that is they're herd animals. And so being with another older companion that is calm in that environment can really be beneficial. So maybe you're trailering a young horse for the first time and you know that that's really stressful for them. You might try a little Calm B, but also how about trailering them with an older horse? Now, I was asked to touch on CBD because it's certainly getting a lot of airplay right now in the human world, in the pet industry, in the horse industry. And these are some excerpts from a presentation that was done at the American Association of Equine Practitioners Convention this year by Dr. Charlotte LaCroix, who is a veterinarian turned attorney. And she had some very insightful information, pretty much directed at veterinarians, but I feel like we hold ourselves to much higher standards than most other companies. So 6 states veterinarian licensing bodies acknowledge that a veterinarian could lose their license if they even discuss CBD with their clients. 2 states said that you can have a conversation with your client, but only if they initiate the conversation. And 18 states you may discuss CBD products, but you cannot prescribe them or dispense them. Very interesting. Even though a state may deem CBD legal for human use, it is still illegal on a federal level. The U.S. Food and Drug Administration, or the FDA, does not approve the use of hemp in any form in animals. The FDA has already approved CBD in humans as a drug. Now that's the kicker right there. A product cannot now be introduced as a nutritional supplement if it is an approved drug. Nutritional supplements must contain one or more dietary ingredients that are naturally occurring nutrients in the horse's body. CBD is not naturally found in animals, therefore CBD cannot by itself be a nutritional supplement. Nutritional supplements cannot have any claims to treat, mitigate, or prevent disease. Otherwise, they would be drugs and would need to be approved by the FDA. So as a veterinarian, if you were in a court of law, how would you explain why you were recommending CBD to your client? They would be recommending it to treat a specific condition such as pain, lameness, inflammation, anxiety, stress, and stereotypic behaviors, among others, because you would be recommending it to treat those. Little research has been published supporting the use of CBD in horses. Most of the data has come and research has been conducted in small animals. And there is some really, really fascinating dog research, but it's just not kind of legal for us to be recommending it right now. CBD is widely available and owners already use it prolifically. It is really illegal for a veterinarian then to promote. Is it really illegal for veterinarians then to promote its usage, even if the product was purchased by the owner? The short answer is yes. However, the FDA simply does not have the resources available to stop this activity. So I get asked that all the time. Well, why is it being sold? This, I think, is the best answer to that. It's like speeding. We all know it's illegal, but people are willing to push their luck knowing their chances of getting caught are relatively low overall. So as an individual, you can go do whatever you would like to do, but as a company, it's why we can't actively promote or sell a CBD product at this time. You know that we really back everything with science foundation. We have the National Animal Supplement Council logo on all of our products. We hold that in high regard. If you look at any other companies that are also NASC members that are actually selling a CBD product, they cannot put the NASC logo on it. And at this point, we're just not ready to do that. So think of when a client comes to us and says, I think I need a calming supplement, let's really dig deeper and be true solution offerers to these folks. Think that horses in the wild graze almost continually. We put them in stalls, we feed them high grain meals and not enough forages. That right there, we've talked about this over and over, how that can impair gut health and that can change their behavior. So the microbiome, we know that the microbiome itself, the bugs that live in the hindgut, there's this thing called the gut-brain axis. If that microbiome gets upset, it's going to secrete certain hormones, certain toxins that are going to cross into the brain, cross the blood-brain barrier, and that right there, the microbiome itself can change the horse's behavior. All right, so the first thing is get every horse on deck digestive feed additive to help mitigate that hindgut. If we know that there's more serious issues like some diarrhea, some symptoms that would lead us to believe that there's more serious hindgut pain, then the Cool Gut or the Rescue Aid paste. We want to do small meals often, slow feed, forage options. Look really hard for pain. Bring in some other experts that can really evaluate pain. Make sure no stone is unturned. Don't just be asking trainers, ask veterinarians, ask more holistic practitioners that can really dig deeper into this pain issue. And if a true calming supplement is needed, then absolutely recommend the Calm B. It's great. But again, it needs to be fed prior to that stressful event, and pair it with other management practices. Pair it with, a companion per se. So this was a relatively quick presentation tonight because I knew there'd probably be quite a few questions.